Good evening. It's my pleasure to welcome you to this webcast, which will address ways to help you take your IBD medications and the related impact on your health. The Children's Digestive Health and Nutrition Foundation hosts our discussion tonight with support from Centocor and Shire. I'm Dr. Wallace Crandall, Director of the Center for Pediatric and Adolescent Inflammatory Bowel Disease at Nationwide Children's Hospital in Columbus, Ohio, and Associate Professor of Clinical Pediatrics at The Ohio State University College of Medicine. I will be serving as your moderator tonight. Approximately 1 million Americans, including an estimated 100,000 children, have Crohn's or ulcerative colitis. Medical management of IBD typically consists of using multiple medications, often on an indefinite basis, to prevent relapse of symptoms to reduce the risk of long-term complications. Adherence to medical therapy means that you are taking medications based on your doctor's advice. We are discussing this issue today because children, teens, and young adults with chronic illness are at an increased risk of being non-adherent given the variety of medications that they are expected to take at the same time. Other things that contribute to poor adherence, especially in IBD, is the fact that the patient might not see immediate results from medications, their disease may worsen even when they are adherent, and taking medications while in remission can be difficult because they feel fine and may not see the need to take medications. Some patients can also be non-adherent without experiencing an immediate negative consequence. Many of you took a survey about these issues when you registered for this program. Here are the results. 56% told us you manage your IBD poorly or only fairly. 44% said you manage it rather well. 49% said that your medications are the most difficult thing to manage related to your IBD. 38% said that you take your medications on your own, while 53% said your parents help, and 6% said you get assistance from friends and others. Just 3% said you use technology to help remind you to take your meds. And 26% of you said you missed 20% or more of your doses in a given week. And that is why we're here tonight, to share solutions on how best to consistently take your IBD medications, to openly discuss the difficulties, and to recognize that these experiences are normal. We want you to know that there are ways to overcome these challenges and that you are not alone. I'm pleased to be joined by our panelists who all have a personal connection to IBD. Let's meet them. Barb?
Hi, my name is Barb Hyman. I'm the Pediatric IBD Nurse Coordinator at Nationwide Children's GI Department in Columbus, Ohio, and I coordinate the inpatient and outpatient teaching for newly diagnosed children and their families.
Hi, I'm Kevin Hummel. I'm a pediatric psychologist and assistant professor at Cincinnati Children's Hospital Medical Center and the Center for the Promotion of Treatment Adherence and Self-Management. My research focuses primarily on measurement of treatment adherence in children and adolescents with IBD and developing and testing interventions to promote appropriate self-management in children and adolescents with IBD.
My name is Erin Dunn. I'm 11 years old, and I was diagnosed with Crohn's disease about 5 years ago.
My name is Mary Kay Dunn, and I am Erin's mother.
My name is Haley Shaw. I was diagnosed with Crohn's when I was 9, and I am 16 years old.
I'm Colleen Shaw. I'm Haley's mom.
Hi, I'm Richard Herr. I'm 23 years old, and I was diagnosed with Crohn's disease when I was 18.
Hi, I'm Paul, and I was diagnosed with IBD when I was 11, and I'm 19.
Thank you all for joining us. Today's discussion will be divided into 3 topics. First, self-monitoring and the use of new technologies. Second, problem solving. And finally, good communication. I want to draw your attention to the question submission box on your computer screen. Feel free to send us a question anytime during the program. In about an hour, we'll pick a few of these to discuss. Let's start with the topic of self-monitoring and using technology. Haley, what were the biggest challenges you encountered when you were first diagnosed and had to take so many medications?
When I was first diagnosed, I had numerous medications I had to take, and I had trouble remembering when to take them. And also, telling people about my disease, it was hard for me to explain to them what I actually had.
And how's that sort of changed for you?
Now I know what I'm explaining to them, and I can give them some detail about what's going to happen and if I'm having a certain procedure done or what I'm taking medication-wise.
So you had a lot of medications when you first started?
Yes. I used to take 17 pills a day.
And how did you get so you could organize that?
We sat them out in a medication container Monday through Friday, and I just took it day by day.
And Mrs. Shaw, how did you participate in that? What was your role in helping her get started?
Mostly the biggest thing was to tell her that she needed to take her medication, because if she didn't, she would feel worse. And I think that was very important for her to understand, that taking her medication every day would help her, but setting them out every day, you know, and putting out what she had to take in the morning, what she had to take at night, was very much the biggest, I think, problem we had, was making sure she took it all the time.
Are there other people on our panel who had a similar experience?
In the very beginning, it was hard for me because, one, I didn't know how to swallow pills, so I had to start practicing, and I practiced with Tic Tacs and Skittles, just so if I'd mess up swallowing them, you know, they didn't taste bad. And I finally got down to, you know, taking medicine and being able to take all my pills. And then when I was diagnosed, I was only 11, and the biggest thing that helped me were my parents, because they understood how important my medicine was. And you know, I didn't take any medicine before, and so they really stressed how important it was and how to never forget. And that's when it all really started coming together, was when my parents helped me. And then since they understood more than I did, it really helped in the beginning.
So where'd you come up with the trick of the Tic Tacs and the Skittles and all of that?
Just one day I was looking at some Tic Tacs, and I was just like, I wonder if, you know, those are a lot smaller than my pills. I was like, I wonder if I should start trying on something, you know, smaller, and then work my way up. And I just, every day I'd, you know, have my box of Tic Tacs, and just once in a while just keep trying to swallow pills until I could, and then start with the Skittles and then my medicine.
That's a great idea. That's a great idea. Any others had similar experiences at getting started?
When I started taking my medicine, I remember that I didn't really know how, so I just took the pills that I had, and I just took some of my favorite foods, such as bananas or applesauce, and I just put my pills into them and just ate them like I normally would have. And then as I got older, I started eating, taking my medicine without food and just swallowing them with water.
So Haley, coming back to you for just a minute, you were saying 17 pills. That seems like a lot to deal with. How old were you when you were diagnosed?
When I was 9.
When you were 9.
Mm-hmm.
So as a 9-year-old, you were having to learn how to do this.
Mm-hmm.
So how specifically did you guys come up with a program that you could remember to get everything done without it affecting your life to the point that it kept you from doing what you wanted to do?
The regimen was very hard at first, because you had to take a lot of the medicines 3 times a day. So you had to worry about taking it at school. But I think just, it's hard to say. We just decided that this was important for her. So, like I said, we laid them out every day. Between my husband and I and Haley, we all reminded each other.
And when you laid them out, what did you do specifically?
We had Monday through Sunday pill bottles, or pill container, and it had morning, noon, and night, and we laid them in each individual, so she knew which pills were for morning on Monday, which pills were for the afternoon that she could take, and then the ones in the evening that she took.
Okay. And where did you keep the pill box or whatever?
We put it up in the cupboard above our stove, just so not everybody could get to it. But during the day, we would keep it up there. But when she was ready to take it, we'd have it sitting out so that she would see it, and it would get her to remember to take it.
Mm-hmm. Did other people use pill boxes? Is that helpful?
Yes,
Yeah.
we did also.
And
Yeah, but I think it's the routine. I think it's very important to have that set routine like what you're speaking of, so that it does become just like brushing your teeth, or your daily routine of what you do before you go to bed, or like during lunch, breakfast, whatever.
Some people will even tie taking their medicines to other events in the day, like brushing their teeth or setting
Yes.
their alarm or other things. Is that something that you guys did?
I always did it with my meals, like breakfast, right after breakfast, morning medicine, right after dinner, night medicine. And then the afternoon I always found would be the hardest, you know, coming home from school, going to practice. So my mom would always be home when I got home from school, so she would always be there and make sure I'd have a sandwich and then my medicine. So that was always helpful.
Perfect.
I always took mine with my meals as well. And definitely, like previously said, the pill containers are a huge help because it's so overwhelming at first, all these pills, and to actually have them laid out in front of you where you can see each day what you need to make sure you're taking helped a lot.
One of the things the pill container helped with is that, because I had the 7-day thing too, so if I'd miss, 3 morning doses in a week, we'd be able to exactly see what days and what doses I'd be missing the most, if it was normally the afternoon ones or the night ones. So then my parents would help stress on those and make sure I would be taking those.
So that's a good point. I guess these pill boxes can sometimes not only remind you to do it, but they let you go back and figure out if you're missing things on a consistent basis. Are there other ways that you guys found to sort of look back and figure out if you're missing something consistently to try and plan for it better? Or was that the major way that you used it?
I think that's the way we used it all the time. It just became a routine for me. I started remembering, and I knew if I didn't take it, I would be sick. So.
And is this something you guys all still do? Do you still use pill boxes?
No, I didn't when I started getting, 16, 17. I was more independent, understood everything, and my parents, they were still there and would still make sure I was taking all my medicine, but they knew that I'd be going off to college in a couple of years, and so we slowly started the transition from high school to college, trying to let me take my medicines more independently, because they knew I'd been taking it for 5 years and I was in a pretty good routine by then. So it was always preparing and planning ahead and everything.
Great. Dr. Hommel, so can you tell us a little bit more about this? I mean, why is self-monitoring so important? Can patients and parents and friends do things to help in this process?
Absolutely. And these are some great examples from our group here of how they've used self-monitoring in their lives and used it as a family and team effort. Adherence is important, but it's important to know that not taking your medications is very common. It's actually probably the norm, to miss a dose here and there. Everybody does it, it just happens. Life gets in the way. Practices, things like after school activities, things like that can get in the way. But what we do know is that patients who regularly take their medications do better than those who don't take their medications regularly. So obviously taking your medication is important. There's a number of reasons, why self-monitoring is helpful. For one, it can help you take your medications on time. You mentioned, Paul, that you used a pill box, and that helped you kind of remember when to take medications. Haley, I think you mentioned that as well. That you use those devices to help you remember when to take medications. And you also mentioned that you could go back and see what medications you missed. One thing that a pill box can help with is making sure that you don't take too much of a medication. So if you're taking it straight out of a bottle, it's not as common to take too much of a medication, but it does happen. So sometimes you can end up taking, doubling up on doses on accident. Again, life gets in the way. You get busy with other activities, and suddenly, at the end of the day, you realize, oh boy, I accidentally took two doses of that one medication that I was only supposed to take in the morning. Self-monitoring in and of itself, so keeping track of your medications actually has been shown in research to improve medication adherence. So just simply tracking your doses can actually improve your medication adherence. And it's really something that everyone can be involved in. This is something that I think Haley's family was a great example of. And you guys talked about how it took a family effort at first. 17 pills a day is a lot. And having all the family members involved can obviously really helps with you. It can help with everyone at home too. So as far as what patients can do, there's a number of things that patients can do themselves. One thing is they can use checklists, diaries, alarms, reminder notes, some of the alarms like on watches and cell phones and things like that can be very helpful. Scheduling meds into your routine. So a couple of people mentioned, that they took medications around times when they were brushing their teeth or setting their alarm or with meals or things like that. Keeping the medications where you're going to be taking where you're going to be eating, at your place at the table, keeping them by your toothbrush in the bathroom or things like that can be very helpful as well. Parents can be very helpful in terms of monitoring meds by asking if they were taken. Now, there's a fine line between asking when a medication is taken and bordering on that nagging, area, which I think teenagers are specifically sensitive to. But I think it's all a matter of how parents talk to their teens and talk to their children about taking the medications. But you can ask the question of, did you remember to take your medication today, without it being a big issue. I think the other thing too is that a lot of times when I've worked with families, parents will say, "Oh, well, I do monitor, my kids' medication, but they don't actually know that I do that. I'll count the number of pills that are left in the bottle or things like that." Unfortunately, that taking kind of a sneaky approach to it only ends up making things worse, and it can cause some family conflict and things like that. So what you really want to be is very transparent about it. Be straightforward. Let them know that you're going to be keeping track of how well they're taking their medications, and incorporate that into the discussion. Be supportive and help with reminders. It's okay to remind your child that it's time to take your medication. Before you go to bed, make sure you take your medication. But ask how you can help your kids. Encourage discussion around this issue. In terms of friends and significant others, and this is something that maybe the folks in college now can talk a little bit about in a minute. But friendships are very important, obviously, but they can be important in terms of remembering to take your medications, making it to doctor's visits, and things like that. The most important thing that friends and significant others can do is really provide their support and their friendship. Be that person that the patient can talk to, and be that confidant. I know, Haley, you mentioned that now you feel more comfortable talking to your friends about IBD and what it means to have it, and the medications that you have to take and things like that. So it's important to develop those friendships and those relationships with others. But they can also, friends and significant others can help with reminding as well. Text messaging is the thing these days. You don't talk on the phone. You text people. There's no reason why your friends can't text you to remind you to take your medications, or to make sure you schedule that follow-up appointment with your physician. Technology, there's a number of different technologies actually. This is a very exciting time in the development of technologies that are able to assist patients in taking their medications. There's several internet sites actually that can send personalized text messages to patients' cell phones or parents' cell phones. And they can serve as reminders. They can even provide feedback and give you graphs on how well you've been taking your medication. There's cell phone applications that you can download on most cell phones. Can have a cell phone application where you can monitor your medications and can send you reminders as well. There's also electronic pill caps, pill bottle caps, and electronic pill boxes that can send you reminders that can blink or beep or show you how many of the medications, how many times you've opened the bottle, things like that. That can be useful in terms of giving you feedback on how well you're doing. And then the last thing really is pharmacies are really getting on board here in terms of developing internet applications on their websites that allow you to kind of track how well you're taking your medications and get feedback on when it's time to refill and things like that. So there are a number of different technologies out there available to people now.
All right, thank you very much. That was great. So one of the great things about the internet is how interactive it can be. Here's an example. We'd like to invite all our viewers to participate in a few polls during this program. When you see a question in the slide on the right side of the computer screen, choose your answer from the options below the slide window, then click on the Submit button. The first question is up now. Keep your eyes on the screen, and in a minute or so, a second question will appear. Toward the end of the show, we'll review the results. Okay, while our viewers are taking this poll, which one of our patients or moms have other ideas on how to self-monitor?
I always used my cell phone for like appointments, and when I was taking shots every 2 weeks, I'd always have my calendar in, and like for my appointments, right when I'd find out when my appointment was, I'd go in my cell phone, type that date in, set an alert for 2 hours before the appointment, and also a day before. So if I forgot about it, it was 6 weeks away, the day before I'd get a little message on my phone saying this appointment, this time. I'm like, okay, and then just in case, I'd have it 2 hours before and ready. And that's what it was like with my shots too. I'd take the shot, and then right after, I'd go 2 weeks ahead in my calendar and place it in, and just so I'd know not to miss the shot. And then also, my parents with the shots and appointments were very helpful too.
Great. Now, we've talked a lot about how to remember to take medicines. There's certainly people at different times in their life where they'll sort of get frustrated with this whole process and think, I'm not sure that I want to take medicines. And that's sort of a different issue. Have any of you ever had have you been at a point where you just thought, I just don't want to do this anymore?
I've had that happen to me.
Yeah.
Where it's just like, it's so repetitive and you're just kind of like, are they really that big of a deal? So you'll miss one and nothing will be that bad because you'll do the rest of them. Then you'll miss a couple in a row, and all of a sudden a week down the road you'll have like a flare up and you realize just how important it is to make sure you're taking that, and then you don't want to bother testing, not doing it again.
I remember when I first came to you, you told me that most of the kids, they're very good with their medicine their first few years, and then once they get into their teenage years, 16, 17, 18, that they start feeling, I haven't had a flare up in 5 years, I don't need to take it every day, and then you start getting complaints and everything, and you just slowly start missing them, and you don't realize it before, and then all of a sudden you're sick again, and you're like, he told me, and it exactly happened. And it's hard though, because it's every day, every hour, there's something about it, and so it's a struggle, but it's easy. It's a lot better if you have your support and technology and everything to help remind you and keep you going through.
Great.
But I think an important point about the teenage years is that it may be harder, and we don't know this, but it may be harder to take your medicine, in your teenage years, because that's when you're really developing more relationships, and it's hard to take medications in front of your friends if they don't know why you're taking medications. I mean, who wants to swallow 17 pills in front of all your friends if they don't know why you're swallowing 17 pills? And that's a very difficult issue to confront, and I think that's when we do see some of the problems coming up. Does that sound like anything that anyone experienced?
Yeah, I used to explain to them why I was taking pills, and they would get confused. They would be like, well, why? I just don't understand. You shouldn't have to take all these pills. But I'd explain to them, I will get sick if I don't take these. Mm-hmm. And they'd understand after a while. You have to explain to your friends and family and your loved ones that it is important that I take this and I really need your help, like remembering to take them, and they'll help you.
Or sometimes they're nauseous when they are supposed to take a medication, so they stop taking it for a while, and then it shows on some blood tests or something, and you really have to start pushing them. Even at this age, at 16, Haley's very responsible. I usually taking her medicine, but there are days in the morning where she just doesn't feel good, and she knows she doesn't take it, and she doesn't tell me, but then eventually she tells me, and we just try to work harder at finding what's going to make it easier for her not to be nauseous in the morning, or make her just think, okay, I can get through this one pill. A lot of times, like taking it with a medication, or taking your medication with something to eat, is important, but it happens.
There's a lot of great ideas, and thank you very much. Okay, let's move on to our second topic, problem solving. Many would say that problem solving is a required skill for dealing with the challenges of taking IBD medications and managing IBD in general. Anyone with IBD has to deal with the challenges that this condition brings into their lives. Richard, what were the obstacles you faced in managing your IBD and taking medications while in college and away from your home and parents?
My biggest thing was being accountable for it, because you don't always have somebody right there beside you constantly saying you take your pills, even though my mom at times would call or text over and over again to make sure. But just mainly being accountable, writing a schedule out, making sure you have time, you're going to be able to get your pills. And another big problem was where if I was with my friends and we just want to go do something out of nothing, or just go out on a whim, go stay the night somewhere, I have to make sure to go out of my way and have those pills with me. And sometimes it can be a nuisance because it's like, hey, I got to stop back at my place first. We got to wait a while. But most of my friends have been very understanding about it, and they've helped with that.
Do your friends know why you needed to stop back at your house, or is that none of their business?
At first they didn't know, but I had to tell them eventually, considering a lot of them I'd live with eventually. So, I mean, they were understanding about it. At first they're just kind of like, never heard of it before with Crohn's, and they're just kind of like, okay, what is that? And then you got to explain it to them, and they're just kind of like, yeah, I just prefer to know less. So. And they're understanding with it and say, all right, anything we can do to help you, they do.
Mm-hmm. And you said that your parents were pretty good about calling and texting and that sort of thing?
Yeah, especially my mom. I mean, my dad would occasionally call just to make sure everything was going okay, but the mom would, especially in the early months, would make sure I was on the ball and doing what I was supposed to.
Yeah. Now, when were you diagnosed in relation to college?
I was diagnosed 1 month prior before I left for college.
So you were just getting started with all of this.
Yeah, because there was a debate in my house on whether I should even move to Columbus, because I live like 2 hours away, so it was a matter of, is it worth going right now? Do I want to wait a quarter? But it was something I've been looking forward to for so long, I was ready to go on my own and do it.
Yeah. Now, Paul, with you it was a little bit different because you'd been diagnosed for quite a while before you went off to college.
Yeah, it was, we knew what was coming, and so that's why we heard stories from people moving far away with this and then having struggles and having to move back. So I wanted to go to a place, I could get my space, but I would still be only an hour away from home. And so the hardest thing going into college was, in high school I always had like pretty much the same routine, going to school, practice, and every day. But in college, every day is different, and so that was the toughest thing. And so I started just sending myself alarms just 3 times a day when I know I'd have, free time that I could take my medicine. And then I'd start getting down into that routine, knowing when I would have free time usually and be able to take my medicine and everything like that.
So did the way that you handled things, the way that you reminded yourself change from when you were at home to when you were at school, or did you just have to be more responsible for the old routine?
It definitely changed because, in high school I would always wake up at the same time, eat breakfast, take my morning medicine, go to bed pretty much the same time, take my night medicine. And so then at college, sometimes you have classes at 11 in the morning or 8 in the morning. So, you can be waking up 3 hours apart each day. So, you just have to really get used to, right when I wake up, reminding yourself, I ate breakfast, medicine. And then the hardest time in college would be during the day because, you're at classes every once in a while, you get a lunch break, but you go out with your friends, and then all of a sudden it's 6 o'clock before you know it, and you're like, I just didn't even think about it. So that's why it was really important just to set an alarm in the middle of the day saying, it's this time, you need to take your medicine soon, and then I'd be like, okay, I need to go back to my apartment and take my afternoon medicine. And so it's just really important setting an alarm and just reminding yourself, because in college you will forget because you're always running around and doing everything. So.
Did you ever take your medicine with you, or did you always go back to your place?
Yeah, when I went to college, I brought a couple pill capsules if I knew I'd have, 2 exams and I'd have to take a class and then go study at the library for 4 or 5 hours. So I'd bring my medicine with me. And that was really helpful because then I wouldn't have to, run from class to my apartment, back to the library, to class. And so having a container with you is very helpful in college.
Yeah. So there's certainly other problems besides going off to college. Aaron, are there parts of your life that got interrupted by having IBD or having to take medicines, sleepovers or whatever the case may be?
Actually, a couple of times when I'm hanging out with my cousins and they want me to sleep over, sometimes my mom just has to say no just because I don't have my medicine, and I've gotten mad a couple of times, just because, unlike other kids, I can't just because I don't have my medicine.
So what did you do about it?
I usually just let it go, because I know it's important that I have to take my medicine or else I'm not going to get better.
We used to leave some in the car. If we were going somewhere, there might be a possibility, you always have to think ahead. We would keep some in the car, extra, so that if she did pop up and say, hey, I want to stay the night here or want to stay the night there, we were prepared. So sometimes I think being overly prepared is better.
Mm-hmm. Did you guys ever do anything like that?
Once or twice, I've kind of figured maybe something like that would happen, and she wouldn't know, but I would have it, and I'd be able to say, yeah, this time you can. But as far as skipping it, no, it's not real optional.
Yeah. So mom wasn't always the bad guy. Sometimes mom was looking out for you.
Occasionally I come up with, yeah.
Okay.
It's mostly no, though.
Haley, how about you?
Sports were a big thing. I always had trouble, like, I would never really have to take medication when I was playing sports, but like keeping up with all the other kids, that was kind of hard. But sometimes, yeah, I'll have to take my medication when I'm playing. Like, if I get nauseous or something, I'll take my medication. So.
Okay. How about school? Medicines or IBD ever interfere with school?
Yeah, I used to have to take some in the afternoon, but if I ever forgot, the office would come and get me and say, here's your medicine, you need to come back and take it. So they were always really good about that.
So did you communicate with the school, or mom, did you do that?
When we started out, you had to write a letter and take in the prescription, and they would make sure that she got it every day. That was nice because then she didn't forget. Like she said, if she didn't go down at lunchtime, they would come and get her. So, but that was a big deal because you have to make sure you have plenty there. You have to make sure that the nurse knows how to give it to her. She has to know also, she had to take the responsibility of knowing how much she could get, because, you know, I always was worried that somebody would give her more than she needed. And she did take that responsibility on at a young age.
What about missing school for doctor's appointments and stuff? Was that causing any problems?
I used to take, well, we still take a day off when I just come to Children's, and it's just like a whole day thing. I'll go to the appointment and go to the infusion clinic, and then it's kind of like we try to make the day fun because we know it's going to be long. But I've missed less and less school days now because I've gotten my disease under control. I used to miss 30 or more days, and now I only miss 10, maybe 20.
So you're trying to turn a negative into a positive, basically. Yeah,
Yep.
you have to miss a day of school, but at least you're going to get some shopping done.
Yeah, it's going to be fun.
We take the same approach.
Yeah.
We drive a couple hours to go to the hospital. So we try to do the same thing, is, you know, you need to make it fun. So.
But what about the schoolwork you missed?
Teachers are good about, like, holding you off. Like, they don't always make you make it up. Like, when I had my surgery, they let me off so easily. Like, I didn't have to make up anything, and I did fine. I got A's and B's, so.
Yeah, it's really important, I found out, to communicate with your coaches, your teachers, your principals, because once they find out what you're going through, they're always willing to help you. You know, I'd see teachers in the hallway and they'd ask me how I'm doing, if I need any help with any schoolwork or anything. So I'd say I was always scared to talk to my teachers about it and my coaches, but once I started talking about it and knew that they cared, it was really easy, and it really started helping, because the more people that know what you're going through and want to help you, it makes the process a lot easier.
Definitely communicating, because I've noticed that I've never met a professor or counselor who I've told about who hasn't wanted to help me, or would do, like, if I asked them for something, would say no. Like, they realize it's something that you can't really control, and they're going to do anything they can to help you out, because they realize it can be real hard, and a lot of times they know people who go through the same thing, so they can relate to it.
So Barb, as an IBD nurse specialist, I'm sure a lot of what you do is helping people sort of work through problems. So can you tell us a little bit about how they can problem solve?
A lot of times what we do is initially when my patients come in for their teaching, and I do teaching we have 17 practitioners in our facility, we spend a lot of time about medications when we talk about being newly diagnosed and what the importance of self-management can be, how important it is to learn to manage taking your medications, how to manage your disease. So we spend a lot of time talking about that, particularly in our teaching process. And if there is a particular problem that they or concern that they do have, then what we do is we address those with me at the initial teaching. And then we also refer them over to their physician. For example, like Paul said, I have a difficult time taking my medications. I can't swallow those. So we help them a lot through how they can swallow their tablets. We have a number of people within our IBD team that we can refer to, such as our psychologist that we have on board, our child life specialist, particularly if there's kids who have difficulty particularly taking the medication, even alone swallowing it. We can sit down and identify what can we do to help you as far as coming up with certain solutions. Another example would be you guys talk about taking your medications 3 times a day. So we address that issue. We know that's important that you do get those medications in. It seems to be that middle dose seems to be the hardest one to remember. So a lot of times we will talk about maybe there's a different medication possibly out there that you can use that you maybe only have to take twice a day or once a day. So again, we direct you back to your physician for that. So I tell people if you have concerns, if you have problems, I direct them either to me through a phone call. When you come in for your clinic visits, we talk a lot about when we talk about how often you take your medications in the last 2 weeks in the past 2 weeks, we can identify problems that way with you. So we do rely on a lot of self-reporting and a lot of phone calls with you if there are a lot of issues. I think another problem is the fact that I have a lot of patients like Richard and Paul who are at that time of transitioning from high school into college, and we talk a lot about how you can learn to manage your own, taking your responsibility as far as calling in for your refill prescriptions. So that becomes a real issue. And I have a lot of patients whose parents are still doing that when they're 19, 20, 21. So we talk a lot about those issues and what we can do to help you out as far as what's the best way that you can take over doing this yourself. So we talk a lot about transition early on in their disease process.
So there's got to be resources out there to kind of help you problem solve. What are some of those resources and how do you go about finding them?
The hospital was always really good with, they always had a dietitian there. So when I was always a wrestler, so she'd always help me with what to eat, what would help me put on weight and everything, because food is such an important part of this process. So having the dietitian talk to me a couple of times a year would really help me know what foods to look for and what foods could hurt me, and that resource always helped a lot.
Good. What other resources are out there?
Well, I know the internet. I mean, a lot of people on the internet, you just kind of want to take with a grain of salt what they say because sometimes they just want to complain a lot. But there are people who give their opinions out there on their trials, what they went through, and everybody has it different ways on certain things they can eat, certain things they can do differently, and it's good to read what other people went through to really see what helped for them when they went through this. So if you're going through a similar situation, you can kind of relate and maybe even try to do what they did to help you out.
There's support groups also out there. We have one that just started in Delaware, and there's also Central Ohio has a Crohn's and Colitis Foundation that you can get information off of.
Okay. Other resources out there?
The Columbus Crohn's and Colitis walk that we've gone to, each year you'd always meet a lot of people. A lot of people have gone through the same things, and people that have experienced what you're about to go through that can give you tips. And I always found those have been really helpful with personal experiences and knowing what to expect then.
So Barb, there's a slide showing sort of a process
Yes.
of self-management. Can you walk us through that a little bit?
So pretty much if you look at the slide, number one, the important thing is you need to recognize what the problem is and define what it is. So Paul, for instance, realized at the age of 9, I can't swallow a tablet. What can I do to get me to swallow a tablet? clearly I can't swallow it whole. Haven't learned how to do that. So then he came up with a possible solution. He thought, oh, Tic Tacs. That's a good idea. So we started practicing with the Tic Tacs. And then he developed a plan. So the plan was practicing with the Tic Tacs and then slowly advancing to those medications that he could take them on a daily basis and then evaluate how well that worked for him. So he found out I can swallow Tic Tac, I can now swallow my medications. And other things that we can come up with are sometimes those capsules that you can open up. You can sprinkle those. That tends to work a lot too. I don't know what else we could talk about as far as that goes.
Yeah, I think that's good. And it seems like sort of once you go through that process, you kind of have to reassess a little bit and figure out whether that new process is really working for you or not. Okay, so thank you very much. Moving on now to our viewers. Look at the slide screen for 2 more poll questions. While our viewers are taking the survey, can one of our patients give us an example of how you problem solved a medication-related issue? Haley, do you have any thoughts on that?
I don't really know.
Actually, let me ask you a little bit different question. I was searching a little bit before asking about resources. One of the resources that hopefully you have is your physician. And it surprises me. Some people are really good about coming in and saying, you know, I can't get 3 pills in a day. Is there a different way we can do this? And some people will talk to their friends and neighbors and everybody except the person that's prescribing their medication about it. So how can you sort of problem solve with your physician? How can you make that happen?
You can come up with your own ideas. I mean, like, I don't know how to word it.
First, you need to be honest.
Yeah.
You need to be honest with them and tell them if something's not working for you.
Right. And then, I don't know.
Let me ask a question. Haley, you probably feel comfortable telling Dr. Crandall now that, you know, this medication is not working very well for me. Can we do something different? Can we try something different? Did you always feel that way, though?
Yeah, I always felt comfortable around him, talking to him. Like, the first day I met him, I knew he was like a doctor. So you have to find the right doctor that you feel comfortable with, and then you go from there. It's not even about your disease. You've got to find a doctor who's willing to help you and willing to do everything that they can to make you better. And then once you have that, then you work on your medication and stuff.
Because sometimes it is hard to have a conversation about medication not working. When you're going to a professional and they're prescribing a medication, suggesting that this should work, if it's not working for you, it might be hard to have that conversation. But like you said, it's important to build that kind of relationship with your physician, with your nurse practitioner, and everyone else. That, you know, you feel comfortable about saying, can we do something different? Can we maybe move to 2 times a day dosing instead of 3 times a day dosing, because that would fit better with my schedule? Or can we try a different medication because this doesn't feel like it's working as well? Or if I've been taking it for a number of weeks and it hasn't started working yet, is it going to work ever? Those kinds of questions. It's important to have that kind of relationship, I think, with your healthcare team.
I think one of the hardest parts is when they're not sick. You know, we travel a couple hours and, you know, busy lives and all that. So when the medication is working and you don't have any flare-ups and you're going through and you've, you know, done 2 years or 3 years with no flare-ups, and you know, you kind of question, you know, does she really need to be on this much medication? You know, everybody would like to be non-medicated. So, you know, trusting the physician and communicating that to them, you know, that, you know, she looks healthy, she's acting healthy, she hasn't had any flare-ups. So having that trust and that communication is very, very important.
So, Barb, Dr. Hommel, any other thoughts on this idea?
I think the biggest thing that when I talk to any of the patients that come in is communication is very, very important. And I tell people, you as a patient, as a parent, have a right to express concerns, ideas. You have to be clearly involved with your practitioner as far as how you want you to have your care managed. Clearly ask lots of questions. I think that's very important. If there's clearly a medication you really are not comfortable taking, then you have, you know, clearly state that to your practitioner and come up with a plan and work with your practitioner. We're here to help you. And We clearly want to hear from you and know what your thoughts are, what your concerns are. And I tell people, if you still need to talk to anybody, pick up the phone and call with any question that you do have. That's what we're there for. We want you to be very actively involved in your care and your management of your disease.
And I think beyond just talking about whether medication is working or not, I think patients and families need to be comfortable saying, you know, we just can't do 3 times a day dosing, or we just can't take 17 pills a day. Is there any other way we can do this? How can we change things up to make this easier? Your physician, your nurse practitioner, your nurse would always rather hear that than assume that you're taking your medication and find out later that you're not because you're in the hospital and now need surgery or something like that. It's always better to have a very open communication with your healthcare team.
So that was great and a good transition. So finally tonight, our third topic, communication. We found that one of the biggest barriers to accepting help from others is the challenge of communicating effectively. Let's take a few minutes to discuss how our panelists communicate with parents, teachers, and friends about their IBD. And I would like to hear the perspectives of our moms on communicating as well. For instance, how comfortable are you in talking to your doctor or nurse about specific problems? We've heard a little bit about this from some of you already. So those who haven't answered, go ahead and tell us a little bit more. But maybe we can start with Erin. You know, how comfortable are you talking with your doctor about problems? And if you are in a sort of a good place, put yourself in sort of somebody who's just diagnosed and maybe doesn't know their doctor very well. And how would you go about building that relationship and that ability to communicate?
Well, I would trust the doctor because they've been trained and they've studied what you're facing and they know what you're dealing with. So you can ask them any questions and they'll just help because they just know what you're going through.
And we've had very, very good experiences with the doctors, and going from being completely healthy to being to the point where you have to be put in the hospital because you're sick, and you're not used to those surroundings, and it is a real flip of your life actually. And so having the people that are caring and can give you the answers to the questions that you have, especially if it's something that you're not familiar with, it's been invaluable to us, the care that we've received at the hospital. It is, the open-end communication is very, very important because it is something that if you don't have that communication, there may even become a point where you're so scared and not familiar with what's going on that it may have some kind of result as far as her health. So that's been very, very a learning experience for us, and we have switched doctors a couple times during this process, and you do have to have that relationship. You have to build that trust between her and the doctor, and the communication would be how you build that.
So let's say that there's people out there listening who maybe don't have that trust yet or that communication yet. What can they do to kind of start establishing that with their physician?
I would think the knowledge of the disease itself is very, very important, because with that you would gain the ability to ask the right questions. And I think if you know how you are going to, the end result is going to be the good health, that you would be able to have that conversation and ask those questions.
Great. Other comments?
I always felt that it was really helpful to communicate with your friends' parents, because when I was diagnosed, I was always had really good relationships with my friends' parents. My parents knew them too, so they all knew when I was diagnosed. So when I would go over there for a sleepover, they would ask me, do you have your medicine? Do you need anything that, do you need our help for tonight? Or like if I'd go on like a 3-day trip with them, they would always be well aware of what's going on and what medications I have to take. And so that was just another reinforcement. When I was away from my parents and still young, they would know and they would still help me out, and that was really helpful.
So Richard, you mentioned earlier that you had to start telling your friends about what was going on. How did you do that? What did you tell them? And
Well, it'd start out, we'd be like, if we were out eating somewhere and there was a certain type of food that I knew I couldn't eat because I knew it'd bother me, they'd be like, well, why aren't you eating that? And then I'd basically be like, well, it's because it has seeds in it or it has these skins on and stuff like that. And then I just basically would explain why those things are bad and how they're hard to digest and how even just eating something so little as that can have me cause like months of pain, and it's just not worth it to even tempt it with something like that.
did you need to get into details about what inflammatory bowel disease is, or were you able to just sort of say, that doesn't sit right with me?
Well, I usually wouldn't get into details because, like, as soon as I'd start, they'd usually just be like, all right, that's, like, they don't really want to know all the details on, like, what's going on with it. Like, they get the main idea that your digestive system needs some help and it struggles at times, so once they understand that, they get the basic idea of it.
Okay. Do other people approach it differently with your friends? Haley, do you talk in detail about what Crohn's is?
I do. I love talking in detail. I love conversating about my disease because I feel it's important that you get the word out there and people know what you're going through on a day-to-day basis. And every time, like at school, I can do a project on Crohn's, I do it. I knowledge people about my disease. I love telling them about it. And it's very helpful if like your teachers know about it and like you can either tell them or hand them pamphlets. I always hand my teachers pamphlets every year about it, just so they know I might have to get up and leave and go to the bathroom, so you need to just let me go, because it's important.
So Dr. Hommel, we've heard a couple of different ways. You know, some people tell a lot about what's going on with them. Some people give just kind of the basics, just what they need to. Is there a right or a wrong way to start communicating this with people?
You know, I think the rule of thumb that I always talk to patients about is, you know, you should tell your friends and significant others, you know, what you feel comfortable telling them. And there's no right or wrong way of how to describe IBD. Haley's very comfortable, you know, talking in detail with multiple people about what IBD is. That's great. It works for her. Erin might not be that comfortable talking in detail with her friends about it. Maybe she will be later on. You know, Richard, his friends probably don't want details necessarily. Most guys don't want details about anything anyway. That's just the way guys are. But that's, you know, I think that's important to recognize, you know, who the person is you're talking to and what level of information do they really want, and what level of information are you willing to give. So there's really no right or wrong answer, I don't think, in terms of how to communicate what IBD is and what effect it has on you.
So what are the ways to communicate effectively, and what are sort of the barriers to making that happen?
Well, I think when we talk about effective communication and barriers, I mean, we're really talking about how to work around a problem. And oftentimes when I talk about this with patients and families, we're talking about communication between parents and kids. So, you know, really in communicating, there's a speaker and a listener generally. So, you know, let's talk about effective speaking first. So when you're speaking, you want to make your statements clear and brief. If I go on and on and on for 5 minutes about one particular point, chances are the person who's listening to me isn't listening to me anymore at the end of the 5 minutes and hasn't gotten anything that I said. So you need to make sure that what you're saying is brief and to the point. Talk about the problem and not the person. You know, if the problem is you missed a couple doses of your medication, let's talk about missing those doses of medication and when they occurred, not how responsible or irresponsible you think that person is, because that's only going to make the problem worse. Take responsibility for your part. So, kids, if you're missing your doses and you've made a deal with mom and dad that you're going to take your morning dose, but you're rushing out the door, it's important to acknowledge that you had a role in not getting up early enough to take care of what you need to take care of, including taking your medication. Parents, on the other hand, if you made a deal to remind them or to get them up 10 minutes earlier, it's important to acknowledge that you had a role in that missed medication as well. It's important to be, have constructive criticism, but be supportive. Don't forget that constructive part. It's not okay to just be critical of a person and not taking medication. It's important to be supportive. Boy, I noticed that you missed this medication. I know you're trying really hard, so let's figure out a way to work around this. Provide alternative behaviors. So, rather than just focusing on the missed dose, say, well, maybe it would have been helpful if I, got a reminder to take that dose of medication. Maybe then I would have remembered to take it. In terms of effective listening, we're talking about things like paying attention. So if I'm talking to someone and their eyes are looking off to the side, or they're rolling their eyes, or they're walking away from me, I can pretty much guarantee they're not listening to what I'm saying. It's important to meet the person, make eye contact, and show that you're really invested in hearing what they have to say. It's okay to disagree with people when they're talking to you, when they're trying to discuss a problem. It's perfectly fine to disagree, but stay calm. The moment that your voice raises, the moment that you start getting angry, that's when you have a communication breakdown. Don't interrupt each other. The only thing that interrupting does is it says one message. It says, what I have to say is much more important than what you have to say. So interrupting only breaks down communication. And state in your own words what you think you heard in terms of the listener. So if you're listening to someone say something and they're saying, I'm really having a hard time taking my medication because I'm forgetting to set my alarm earlier, or things like that, it's important to reflect back what they're saying. So what I'm hearing you say is that you're really having some difficulty with your medications, and that maybe setting your alarm a little bit earlier would be better. But you're having some problems with that, so let's figure out how to work on that. In terms of communication barriers, we talk about 5 barriers primarily. One of them is using absolutes. Absolutes are things like saying always or never. You always miss your dose, or you never listen to me, things like that. Getting off topic, bringing up the past. So, saying things like, do you remember 3 weeks ago and when you just said this or you did that? Well, 3 weeks ago generally doesn't have anything to do with what happened just now. So let's just focus on what the point is right now. Let's focus on the problem right now. Personalizing the problem. I mentioned this a minute ago. So saying that that the problem is not taking the medication, not that the person is the problem. Don't say things like you're so irresponsible, things like that. That's personalizing the problem. That only makes things worse. Using polarizing language, such as indicating that one person's completely right and the other person's completely wrong. Most often what's true is somewhere in the middle. Not everybody's completely right and not everybody's completely wrong. Mind reading is probably the most common communication barrier. Everybody thinks they can read their minds. Everybody thinks that they know what the underlying message is to what the person's saying. And generally speaking, what the person's saying is really what the problem is. So just listen to things at face value. The last slide here is the nonverbal communication is important. We've all heard about nonverbal communication. This is, eye rolling. This is, fidgeting. This is looking in other directions, walking away, things like that. Those are all, ways to communicate that you're not really listening to them. Nonverbal communication is a significant part of how you communicate with other people. So make sure that it's not just what you say, but it's how you say it. It is very important. Be specific about what the problem is. Don't generalize to other behaviors. So, if forgetting the morning dose is the problem, then don't say, well, you're never taking any of your medications. It's really just the morning dose. So let's just focus on that one specific behavior. Acknowledge the improvement that somebody's making. So, if medication adherence has been a problem over time, acknowledge that your kid's been making some progress, that they've been taking more and more of their medication, but there's still an area where we need to work on. In weekends, for example, I notice you're not taking your medication as well on weekends. Let's try to focus on on the weekend doses. I think the other thing, and the last point I'll make here, is that working in that self-management conversation among your family is a very important thing. I think it has to be part of how everybody manages their IBD. We've had a couple of really good examples of how patients partnered with their families here and how to manage their disease better, and it really had really positive effects. So I think it's really important to have that conversation be an ongoing thing within families.
That was great, thank you. Viewers, on the screen is our last poll question for the evening. Meanwhile, to our panelists, what are some other problems you have encountered when trying to communicate with parents, doctors, or other people who are part of your lives? And actually, I guess I would be even more specific than that. We began by talking about how families and friends and others are a key part in sort of helping us remember to do things and helping us stay on track. Dr. Hommel's just given us a lot of good advice. I am pretty sure that at some point one of you may have rolled your eyes, or one of you may have said you never do this. What kinds of issues have you ever had in sort of frustration in communicating with your family about these issues?
Well, a lot of times if somebody like a doctor or your parents are telling you to watch out for eating this or watch out for doing that, like a lot of times you just roll your eyes because it's something you've always done. You don't want to have to worry about not being able to do that because it's a part of your life. It's a big adjustment. So instead of rolling your eyes, you really got to pay attention to those things because a lot of times it's real important. And if you catch them early enough, a lot of times it can prevent future problems.
Paul, you'd talked earlier about that your parents were really good about calling you when you'd gone off to college and making sure that you were on top of things. Did that bother you?
In the beginning it started to, because I thought I had everything under control and I thought I wouldn't forget, and then sometimes they wouldn't call me for a couple of days, and then I'd forget a couple of doses when they wouldn't call, and I'd still realize I still need people to help me. I can't remember everything right now, and so at the beginning I was just like, you don't need to call me anymore, and then once they stopped I was just like, okay, I need those calls again. So.
Are there other times, the Shaws, are there times where you guys have had discussions about medicines and sort of what's helpful communication and what isn't?
I think one thing that's hard for us is we both have Crohn's disease, and the one thing that I don't take any medication right now, but Haley does. So a lot of times she looks at me and thinks, it's not fair, you don't have to take it, but I do. And I think sometimes I'm harder on her because of that, because I want her to get to that point where I am. But I mean, does that make you feel bad?
It doesn't bother me at all. I like when people are telling me, hey, you need to take your medicine. Hey, if you want to be in remission, you need to do these things. And I don't mind you talking to me like that. I mean, it pushes me to become, be put in remission. I really want to be off all this medication. I'm glad that you do that.
I think as a parent, there's kind of a line where you do trust that they're taking their medication, but you also need to ask. And sometimes Erin gets a little frustrated, when we're kissing her goodnight and it's, did you take your medication? Yes, Mom, and it would be nice not to have to ask that question, knowing that we do trust her, and I hope she doesn't take it as we don't trust her to do it. But again, it's just follow through, and maybe there needs to be more positive reinforcement because she is so good with it, and that would be one of his points. You do need to follow through, but.
And I think they need to know that we care. That's
Yes.
why we say it. That's why we bug them so much. We care about how they feel.
Yes.
Yeah, and it's important to say that. I mean,
Yep.
it's important to give a pat on the back,
Yep.
when you know that they're doing well, and it's important to communicate that, look, I ask these questions and I remind you and I follow up. Sometimes it might irritate you, but, I do it because I care, because I'm concerned about you, because I want you to get into remission, because I want you to be better.
And it is so routine that I think sometimes you miss that point.
Yeah.
And I think we miss that piece of it.
Yep.
So.
I think it's also important, when you tell me that I'm different, but I'm being strong, and that there are kids out there that don't go through what I go through, but that just makes me stronger, that I can do all this at such a young age. Mm-hmm. And I like being told that I'm doing something good, like taking my medicine and remembering everything that I do.
I think one thing too, just to follow up on a couple comments that have been made, that we tend to think that as kids get older, they should take on more responsibility, and this linear thing that should occur where okay, well, you're 14 now, you should be taking on more responsibility than when you were 13. That's not necessarily true, and a great example is Paul. I mean, he went off to college, and clearly he's an adult, but he recognized he needs some help from his parents still in terms of getting reminders about medication. So we shouldn't just have this sort of black and white idea of transitioning responsibility for medication taking. It has to be a long, and careful process, and it has to be, it has to be flexible. It'll fluctuate between parents doing a lot of reminding and kids taking on a lot of responsibility of their own.
Great. Sounds like we have some good examples of communication going on. Okay, now let's take a few minutes to answer some viewer questions that have been submitted during this program and previously during registration. The first question is from Lisa in Ohio, and the question is, should I be worried about my 8-year-old son swimming in our pool? We're just getting over a flare. And perhaps I'll go ahead and take that one. I don't think that's probably something that you need to be concerned about. And in fact, I try and encourage people to maintain as much normalcy to their life as they can. So I wouldn't worry too much about that. The next question is from Lori in Connecticut. I have a daughter with colitis diagnosed 2 years ago. Taking meds fine, has flare-ups and infusions every 4 to 5 weeks, as well as rectal meds every other night. She will not go to support groups or watch this webcast. How can I get her more involved? She's 15 and very much her own person.
Internet. I think if they can find friends they can talk to through emailing, when they don't have to talk to somebody directly face to face. I think it's easier for Haley at the age of 16, when she was younger, to start out that way. That might be an idea. Used to have pen pals.
I think you should really push your kids to get into stuff. I mean, they don't want to, but you need to get them into doing stuff because that's the only way they're going to ever find out that there are other people out there. They have to know that they're not alone.
So Erin, what would you tell her?
I think I would just tell her to try to convince her that she's not going to get better if she doesn't take her medication or get involved and figure out why she has flare-ups every 4 to 5 weeks.
Mm-hmm. Kevin?
Yeah, I think support groups are one thing. It doesn't sound like this person, would necessarily go to a support group. There's an Ibd Camp that's regional across the nation, and I think that's another thing where even in the past I've had patients that were not so keen on the idea of going to camp, but parents encouraged them and they did go. Came back and reported that it was the greatest experience of their lives. I've never heard a negative experience from camp, and I think that it's one of those opportunities to really build relationships with other kids that are going through the same thing. They're taking the same medications, they're experiencing the same symptoms, and it's a really good opportunity to build that relationship. And another thing too, there are a lot of kids are more into kind of anonymous communication now on the internet and things like Facebook. There's a number of different Facebook pages that talk about Crohn's and colitis and dealing with those. And so I think exploring some of those options might be a good way to sort of open that gate to having her sort of communicate with others better.
Great, thank you. Barb, maybe you can take this one. This is from Lori in Indiana. How have any of you coped with the emotional stress related to your chronic illness and knowledge that you will likely have to take medications throughout your lifetime? So what do you tell patients, and then we'll ask these guys how they do it.
Typically what I do is we basically talk that Crohn's disease and ulcerative colitis is a long-time, lifelong process until we can find a cure and a cause. What else is on here?
Stress and
Stressors.
anxiety, depression.
A lot of times I will try then hook them up through the internet, like you mentioned before. There's several good websites out there that they can actually get on and do the chat rooms with other people their ages. I've offered to kids if they wanted to talk one-on-one via phone with another patient who's experiencing the same kind of difficulties or had the same type of difficulties. We can also hook them up that way.
Right. So how about you guys? There's certainly some anxiety that goes along with this, and research suggests that there's certainly a not unsubstantial number of kids who have to deal with anxiety and depression. So have you had any experience with it, or if you haven't, what would you tell people?
I go to a therapist a lot because I have depression because of my Crohn's, but if you go and talk to somebody, it gets better, and you get put on medication, yeah, it's a lifelong process, but it'll be worth it in the end when we get a cure, and it's fun meeting new people that you never met before, so it's worth it.
Going off to college, I only knew 2 other kids going to that college from my grade, so I was going into college, not knowing anyone, just gonna go meet everyone for the first time, and so I was really nervous about that, how they would react. My roommate, when I'd walk in with 6 pill bottles, and just talking to him about it and just letting him know what was up, and then slowly everything got more comfortable, and just communicating again just was so big, because I was really scared, like, is this person think like I'm some weirdo, but I was just really scared going into college, and then just talking to them and letting them know what was going on was really helpful for me.
Yeah, I know for me that, like, I know when I think about, like, what things that I couldn't do possibly, and if I could get down, I just basically surround myself with friends and try to do things that I know I enjoy and keep myself in a positive mode, and then just remind myself that, hey, I can still do these things. Yeah, there may be times where I have to struggle with it, but it can be helped out. I know I can. I'm never not going to be able to do a lot of the things I love again, so that always helped me get through it.
Great. So next question is from Andrew in Pennsylvania, and this is to Paul and Richard. So it says, to the college guys, if or when you started to get a girlfriend, when did you bring up that you had IBD? First date, second date? So how do you tell somebody that this is part of who you are?
For me, it started out where she was over at my fraternity, and they just saw the pill bottles in my room, and basically they asked, what is that about? And I explained it to them and told them about it. And then going forward, if anything ever came up, like, they'd always ask a lot of questions because they'd want to know what's going on, and just be honest with them, tell them everything you can, and then most of the time they'd eventually help you out with reminding you and help me out with things like that. So it wasn't awkward or anything like that around them.
So you just sort of found a natural time that
Exactly. Like, I didn't
came up.
pushed it or like make her like, hey, I'm going to tell you about something serious. Just kind of let her go about her own pace, and when she wanted to know about it, then I explained it to her.
Okay. And generally supportive and well received.
Definitely.
And that's how it was for me too, is just, you get to know the person, and once they see something or they ask a question about it, then you can go into detail and tell them everything and then explain it.
Good. So a question from Troy in Ohio. It says, I notice some of your guests have different forms of IBD, i.e. Crohn's and ulcerative colitis. Are these diseases the same, or do they have different symptoms? So Crohn's and colitis are certainly related disorders, and they often have very similar symptoms. There are some differences sometimes. Crohn's disease may affect growth more than ulcerative colitis, for example. But a lot of the sort of day-to-day symptoms of pain or diarrhea or bleeding or those kinds of things you can see with either one of these disorders. All right. A couple of other questions. The next question was, when you skip your medication, should we double up or call the doctor? What would you say to that, Haley?
I think it depends. Like, a certain medication, if you know, it's kind of common sense. If you know you're not supposed to double up on it, don't do it. Call the doctor. But they're like heartburn medications, and I don't know, it just depends. You have to kind of call your own shots there. It just depends.
I would say first time, definitely call the doctor. And then if he tells you to double up, then you'll know in the future if something like that happens. Well, this is what he told me then, so I know now this is what I need to do. But if you have any doubt or question, you should probably definitely call, I would say.
So get your instructions,
Exactly.
and then you don't need to ask each time?
Mm-hmm.
Yep. Okay. All right. Barb, which flare-up symptoms warrant calling the doctor's office?
Pretty much all of them. Typically, I tell people when you start noticing the pattern of what your symptoms are, and certainly I tell people these can be, your symptoms can be different variations from very mild to very severe. Your symptoms may not always be the same from one flare to the next. So we pretty much do a rundown list, and I usually tell them if you start having abdominal pain, and it needs to be a pattern of abdominal pain over a period of 3 or 4 days. I certainly tell people you need to look at your bowel movements and to look for blood. And certainly if you start noticing blood, is a good time to call. Any changes in your appetite, fatigue, joint pain, fevers, and I tell you fevers can be intermittent, anywhere from 99 up to 101 to 103. Any type of abdominal pain can be from severe to mild, can be intermittent. If you're having any type of episodes of nausea or vomiting associated with your symptoms, you need to call. And the most important thing I do stress is clearly, if you're not sure whether you're having a flare, I tell you to pick up the phone and call. We're always there to answer your questions. You can talk to your nurse, talk to your practitioner as far as I'm not sure whether this is truly a flare. We can certainly guide you through that. So it's important that you do communicate. And I tell people, report early and report consistently is very important.
All right, to our moms. Are you comfortable with other parents giving the medication to your child?
Depends on who they are and how well you know them. I think you know, and certainly the child would know if it's a good situation and you feel comfortable with it, and you go ahead and do it.
We had a problem in 8th grade when Haley went to Washington, D.C., and one of the nurses was giving medication to her, and Haley knew at that point it was the wrong medication, it was too much. And that's very hard, but I was very proud that she realized that. So it is very hard to trust someone, but I think, like she said, depends on who it is, depends on how long they'll be gone, and how much you trust your child.
So yes, sometimes.
Yes, sometimes.
Okay. Dr. Hommel, this question is, my 7-year-old has been prescribed a medication for Crohn's disease. It does not seem to be working, but he's only been on it for 2 months. We're also trying to taper off steroids. He seems to be getting worse the more we taper, no matter how slowly we go. Should we go back to his doctor and ask he be placed on a different drug, or should we give the medication more time to work? It seems like one of those communication issues.
Yeah, I think it is a communication issue. It's also an understanding of how drugs work. So there are certain medications that take a number of weeks to actually start working, get to a therapeutic level. So 8 weeks might not be enough time depending on what medication it is. That would be an important question for the physician and healthcare team. I would say really in terms of having concerns about lack of progression, certainly it's worth calling the physician and finding out if it's a reason to come in and have another appointment and review medications and whether it's worth making a change.
So Hillary in Maryland asks, my 9-year-old son was diagnosed with colitis a year ago. At what age would it be optimal to begin the transfer of some responsibility for taking his medication on his own so that he begins to assume a sense of mastery and responsibility? Colleen?
I think it varies with children, but I think the sooner you start, the more results you'll get in the end. Haley calls in her own prescriptions, her refills. She's done it for a few years, but I think the sooner you start, the better. I think the more responsibility you put on the child, the more responsibility they'll have when they get older.
I would agree. I think that the child has to be very involved in the medication process. Erin doesn't order her prescriptions yet. That's a good idea. But giving that sense of responsibility and following through. Not just releasing all. You do it, and if you don't do it, it's your health. But from the very beginning, I agree with her. I think you need to give some of that responsibility to the child.
And is there a trick to giving enough responsibility without just sort of turning them loose and putting them on their own?
As long as the communication is there, you set up your system like what we talked about with the pill boxes, the Monday through Sunday. At 9, they should be able to understand, how that works, and being able to go back and monitor, like Paul said, if there's pills left in there and it's in the morning, then you have to have that conversation and you need to come up with a solution. But yeah.
Great. Kevin, other thoughts?
I think it's important that this be seen as sort of a trial and error series of experiments with your kids. That you're going to say, okay, well, we're going to see if Haley can handle calling in her own prescriptions now, and give it a few months and see if they're called in consistently. And if they're not, then maybe it's time to pull back on that, have a little discussion about it, and try it out again later. The important thing is, you don't say, okay, at age 13, happy birthday, you got full control, It just doesn't work like that. And really, what we know about behavior change is that when you pile on too much, it sets families and kids up for failure. So you don't want to introduce too much change at one time. Make small steps towards that desired goal.
With the refills, we started that. I said, let me know when you're almost out. She would start that way. And then eventually she just was like, oh, why am I not just calling this in?
Excellent, yeah.
Perfect. Well, thank you everyone for those questions. That was great. Now let's discuss the poll questions we posed to our viewers during this program. The results are in. The first question was, do you keep track of when your medications are taken? 20% of our respondents said that they do not keep track of that. Is that a problem? Barb?
I think that's a real problem. And I think they need to maybe backtrack and look to see what they can do to get themselves back on track, maybe requiring some assistance from a friend, a family member. We talked about, using your cell phone as a reminder, those sorts of things.
The second question, do you know when your prescriptions are getting low and refill them yourself? 36% said no. So how do you remember when you're due for refills? A lot of people remember when the last pill is gone and they're shaking the bottle like this and they're waiting 2 weeks for their refill to come in the mail.
I just look at it. I mean, I usually will I'll call it in maybe when there's a minimum of 5 in there. But you can't call it in too soon because then you'll have too much and your prescription will go up or expire. But it's all on how fast you can get them. If you can't get them that quickly, then you need to call them in when you still have a lot of pills left.
We use 5 as the gauge as well. A certain number so she knows at 5 to let us know. And you can't go too much more than that because of the insurance, and there's a certain cutoff point where they won't refill it. So 5 seems to work for us as well.
I would always see how many pills would be in a bottle and figure out how long the bottle would last me. And then I'd mark it in my calendar, 4 or 5 days before it's supposed to run out. So then that way I would know if I would be taking my medicine, because then I'd know it'd be low. And then 4 or 5 days before, I'd tell my parents, I've got 4 or 5 days left of medication, and then they would order it, and that's how we always did it.
Yeah, I would do the same thing. When you first get that bottle, you can see how many you have, and you're going to know exactly, around this time next month I should need a refill. And so when it gets that, you can set it on the calendar a week early or so, and then when it gets to that date, and then basically just make yourself a schedule of when you're going to go call it in and when exactly you're going to do it, and just make sure you follow through and do it.
Great.
If it's a mail-in, you need to make sure you know how long it's going to take before it gets to you. I think that's important.
Perfect. So then our next question was, do you use internet tools to help remind you to take medications? 96% of people said no. So Dr. Hummel mentioned some of these internet tools. Had you guys heard of these websites that'll send you texts to remind you about your medicines?
I've never heard of that, but I use my iPod, and if you just type into the App Store, Crohn's disease or ulcerative colitis, it'll come up with a lot of free apps that you can download. And one of them, I could track how I was feeling that day, how many bowel movements I've had, was there any blood in it, so much detail. And then you could even send it to your doctor if you wanted to. Your doctor would have to sign up for it, but it's all free, but it's really easy to figure out. It's really helpful.
Great idea. So number 4, do you try and figure out what the problem is and try to resolve it by yourself? 70% said yes, 31% said no. Dr. Hummel, what do you think about that?
Well, I'd be concerned a little bit about the 30%. If you don't know what the problem is and you're not trying to figure it out, then it's likely the problem's going to persist. Sometimes it takes a little bit of digging, and sometimes it takes a little communication with friends and family about why am I not getting better? Why am I continuing to forget to take medications? But I think it's always worth trying to figure out the root of the problem.
Perfect. And our last question tonight was, do you have conflicts with parents or family about taking medications? 33% said yes, 67% said no. I suspect that if we said, had you ever had a conflict with parents, that we might have gotten a different answer.
I imagine.
Yeah.
By show of hands, have you ever had a conflict with your parents?
100%.
Yeah, there you go.
That would be more what I would typically expect, I think. All right. Well, it's about time to wrap up. I want to thank our professional panelists for providing such a meaningful discussion on IBD, and a special thank you to the patients and families for providing tips and solutions for taking IBD medications consistently. Tonight's discussion underscores the importance of managing IBD properly. Our patients and families have shared what works for them and the lessons they have learned. Our professional panelists have highlighted the need to take your IBD medications correctly and on a consistent basis through self-monitoring, the use of new technologies, problem solving, and effective communication. As we've seen here today, managing IBD should be a combined effort between healthcare professionals, family members, and advocates. On behalf of the Children's Digestive Health and Nutrition Foundation, I want to thank our sponsors, Centocor and Shire, for recognizing the need for increased education about taking consistently our IBD medications. We also want you to be aware of some additional resources. I'll mention a few, but on screen you'll see many more. The CDHNF.org website will have an archived version of this program. NASPGHAN.org includes a pediatric GI locator. IBDU.org and CCFA.org also have additional information on IBD. And don't worry about writing these all down right now. After the program's over, you can download the entire slideshow, including the slides listing these resources, by clicking on the link on the bottom of the web page. There are a number of other useful links there to explore as well, but you might have to scroll down to see them all. Finally, we would appreciate it if you would take a few moments to complete a brief survey. It is the first link listed at the bottom of the page. We value your opinions, and your input helps us provide additional resources to you now and in the future. For all of us, thank you for your time, and have a good evening.